everyone, I'm Festus Ibe and I'm a final year medical student.
My name is Tobechukwu Onwumere.
Ayola Jumoke.
Chinelo Gunjukwe.
Dr. Odunfa.
A.M.S.U.L Tochukwu.
Oluwafemi.
Kingsley Okoronkwo.
Laduko Olubusayo.
Yeah, it's World Health Day, and we all know that for the past 7 decades, the guiding vision of the World Health Organization has always been health for all. And this is the impetus and the drive for a worldwide effort towards universal health coverage in so many countries. Experience has actually shown in the past few years that a strong political will is vital to promoting health for all and universal health coverage. I think once again, in this 70th anniversary of the World Health Organization, we should remind ourselves of the role the government has to play, and we ourselves as individuals, as medical students, as health officers, and most importantly, people interested in promoting health. And how do we do this? By, well, working towards the Sustainable Development Goals, which were introduced in 2015.
First and foremost, we need funding for the healthcare system.
I think that the National Health Bill should be implemented well, which states that 1% of the budget of Nigeria should always be allocated to health, and it should be used efficiently to allocate and provide the proper facilities that can be needed to make the health more accessible to the citizens.
To make healthcare affordable and accessible to everybody, I think the government should try to make the health insurance scheme accessible to every Nigerian.
First thing the government should do is create a sufficient budget allocation that will be able to meet the needs of Nigerians, and not only providing the money but also making sure that the money is used efficiently and wisely.
Apart from allocating funds, I think it is important for federal government to create awareness. Let people know various certain disease conditions, the risk associated with these conditions, so that they will prevent them in the first place, and as such, less money is spent on them when they finally come down with such disease conditions.
After the facilities have been produced, I think that an awareness should be created, because the facilities being there just on their own, if people don't know about it, people cannot use it. So I think that awareness should be created to make sure people know about the facilities that have been set in place by the implementation of the law, which pumps more money into the health sector.
The government can help to improve healthcare, making it affordable and accessible to patients by allocating more funds to importing laboratory equipment and facilities that will aid the patients access rapid and accurate diagnosis, which will lead to effective cost treatment.
Also, we need basic equipment for doctors to use. A lot of equipment are not available for doctors to use. Gloves, personal protective equipment. Even right now with the Lassa fever outbreak, a lot of doctors are still losing their lives because of the lack of PPE.
I think what the government can do to make healthcare more accessible, like these rural areas, that's where most diseases are prevalent. So I think they should go into those places, create more hospitals, and not just that, make the services accessible, because most of these people, they don't have the money. So I think those rural areas are the main places. Go there, make it more affordable so they can access healthcare services.
For government to increase the health care in Nigeria, they have to provide all the healthcare facilities to the general people so that they can be able to treat the patients whenever they come.
Another way you can make the healthcare system accessible to everyone is subsidizing some operations, some basic procedures, so that everyone can do it. All you have to do is just to be a citizen of Nigeria, and you'll be able to be provided with these basic operations and procedures.
Also, we need private participation in healthcare. To go a long way in relieving the burden of healthcare of government.
Free medical checkup. Thank you.
Thank you.